So I thought I would start off by explaining exactly what the Area Agency on Aging is and what our primary goals are. Um, in 1973, Congress passed the Older Americans Act to promote the well-being of older individuals by providing services and programs designed to help them live independently in their homes and in their communities. Um, they developed an administration on aging to carry out all of the provisions of the legislation. A central part of the Older Americans Act was establishing a nationwide network of area agencies on aging. So what we do, we're designated by the state to address the needs and concerns of older individuals at the regional and local levels. There are 622 area agencies on aging throughout the United States, and our AAA, we call it Area Agency on Aging, the AAA, helps to help seniors locate community resources and information and assist them in remaining independent and keep them safely aging in place. So we help our seniors 60 plus, our disabled, our veterans, people with chronic illnesses, anyone with Alzheimer's, and of course, our family caregivers. We're identified by geographic regions, and our SEGO Area Agency on Aging consists of Graham, Greenlee, Cochise, and Santa Cruz counties. So what we do is our goal is to maximize the independence and the dignity of older Americans and allow them to remain in their homes for as long as is safely possible. We have coordinators and case managers that work with the older adults and their families, and they are the ones that help to enroll them in support systems and find resources. Through our partnerships and our service providers, we are able to provide a variety of services, information and referrals, congregate meals, home delivered meals, health and wellness programs, transportation, elder abuse prevention, caregiver support, and advanced care planning. So in our office, we are a team of 7, and we cover all 4 counties, and our area is primarily rural and very large, but per capita, we have, just a reasonable population. We have a health insurance assistance program, which can provide you with up-to-date information and tips on what to consider when you're comparing your insurance plans, your Medicare and your Medicaid, your Part A, your Part B, your Part D. There's a lot of resources where you can get detailed information and you can get personalized help by making an appointment. We have Amalia Marin, and she is our state SHIP and SMP program coordinator. We also have a healthy aging and long-term care programs, which my coworker Cindy, she may join us here in a bit. If she doesn't, I will go over her portion of the program. But they assist with managing chronic health conditions. We have several programs available for fall prevention, such as Matter of Balance and Tai Chi classes. We just started a Spanish Tai Chi class in Douglas. So we are now able to translate that evidence-based class for our participants. We also have healthy aging and long-term care programs at the AAA. We have a long-term care ombudsman who is the advocate for our long-term care facilities. She'll identify, investigate, and resolve issues and complaints made by or on the behalf of residents in long-term care facilities. Her job has been extremely challenged this year because, as you know, they were not allowing families to go into those facilities. But she was still advocating for them. None of our services stopped due to COVID. We were quick to pivot all of our programs. We went to online and Zoom information, but the long-term care ombudsman, she was still out there. The difference was, rather than visiting 2 or 3 facilities in an area, she was allowed to go to 1. And so her job got a lot harder, involved a lot more travel, but she was still there advocating and taking care of those residents. We also have advanced care planning. Those conversations, we all want to have a say on what happens to our healthcare and our decisions in the event that we are unable to speak for ourselves. So we have the Thoughtful Conversations program that is run by Ronnie Squires. And she is available to go through the advanced DNRs, the medical power of attorneys, the healthcare and mental health power of attorneys. And she can answer questions about the living wills. So we have that exceptional resource right there for any organization that needs it. Let's see, home and community-based services, we subcontract to the health departments within the 4 counties to provide case management services and supports that are actually provided to the seniors in their home. And we have attendant care, short-term housekeeping. There's some respite care that can be accessed through our case management program. And then we have my program, which is the Family Caregiver Support Care Program. And what I do is I find programs to assist the caregivers and alleviate that stress that we all know comes from the day-to-day caring of a loved one. The extra burden that is put on caregivers can affect them personally. It puts them at a risk with their physical health, their emotional stress. Just working together with some of our programs, we have found that it assists the caregivers quite a bit. And this is where I'm the most passionate. Through COVID, we used to do all of these trainings in person, and we would go to the facilities and we would talk to the people, but with the mandates that came in last March, we had to pivot all of our offers to a virtual platform. So I had to learn Zoom. I had to learn Zoho. I researched topics to make sure that I had valid, relevant information. We created PowerPoints. We created webinars. And at that time, over the first couple of months of COVID, we found out that people were getting really tired of these Zoom meetings. And for a caregiver, it's very difficult to schedule a meeting. Life happens, caregiving happens. And so the individuals, the attendance was dropping off, and it was getting harder and harder for them to access the information at the time that we had it available. But computer literacy and access to information on the internet was one of the barriers that we realized was happening with our seniors. A lot of them are super resilient, and they adapted. They learned the technology. They started Zooming with their families. They were getting better and better at it. So I actually found a caregiving platform that we were able to purchase licenses for. So caregivers now have access to an online e-learning platform that we have purchased the licenses for. It is by invitation only, but it's built specifically for caregivers. It offers skill-based learning on a wide variety of subjects. The content is heavily dementia focused, and the topics include everything from personal care to safety and injury prevention, caregiver wellness. And of course, as I said, we have expert level dementia training from a pretty well-known dementia expert. Her name is Teepa Snow. If you have any experience in that particular field, you'll recognize her name. But again, the registration is right now strictly through me. It's a pilot program that we were able to bring in through the state. And now we have a way to provide on-demand caregiver training in the home at their convenience. And it's exceptional. It's something that I had a situation where I was considering the caregiving role in my own personal life. And I remember getting online and Googling and wading through pages and pages of agencies and information. And some of it was conflicting, some of it was not applicable, but I was trying like a sponge to absorb as much of that information as I could. When I found the True Alta program, it had not been done in Arizona before, and it was information that was readily available. And you can access it from your phone, you can use your laptop, you can use an iPad. It's extremely simple, and all you need is the device and Wi-Fi and an active email account. The best part about True Alta is it's not limited or none of the barriers of being involved in other programs. So I am able to offer this to someone who is a veteran that is getting VA benefits. I am able to offer it to an all-tex, Arizona long-term care patient. Their caregivers are my caregivers. And so there are no barriers as far as duplication of services. In order to receive an invitation, all you have to do is contact me at the Area Agency on Aging. I have just a basic information sheet that I need. We have 200 licenses. I've issued probably about a dozen. And out of those dozen caregivers, over the next 2 years, they will have full access to this platform. Those dozen caregivers, some of those are considered staff, but I have 8 full-time caregivers that are currently utilizing the program. And we started on March 1st. To date, they have actually taken over 56 of the classes. And the classes are in length are anywhere from 5 minutes to 2.5 hours. The perfect thing about it is it's at your speed. You can pause it. You can go back to it. You can refer to it. It's multimodal. It has videos, PDFs. Every one of them has a little check quiz that you can see to make sure that you've met all of the objectives of the class. One of the other things my program does, besides direct referral information and assistance to services, is we offer a support group. We started off in person at Thrive and at the hospital, and we were offering sport classes in the evening. And a lot of the caregivers liked those hours. But once the mandates hit and we shut down, we went virtual and we started doing it online. The attendance was fair, But when we were sitting there, a lot of times it was just myself and my volunteer, and we would be waiting for, participants to show up, pretty much like this. It was a Zoom call, and we would be sitting there. And if we didn't have a caregiver, we would brainstorm. And to me, a support group always seems so serious. Well, caregiving support groups don't have to be serious. As we evolved, we did a lot of laughing because there's certain situations that only a caregiver understands the humor for. We did a lot of crying because there are frustrations and there are things that come up. And we did a lot of sharing, and a lot of information came up. Someone might have the perfect answer for a situation that you are currently dealing with. And by sitting and discussing it with peers, it's informal, it's easy, it's non-curricular, and it's guided by your conversation. So now we call it Pinkies Up. I'll show you my little pamphlet. It's called Pinkies Up, a Caregiver Mingle. And I will be dropping off flyers and literature for distribution on Monday, tomorrow. But our Caregiver Mingle was our response to, why do support groups have to be so serious? We want to create caregiver communities and have people come in. It's every Tuesday at 2 for tea. We thought that was pretty catchy and it's easy to remember. But basically, it's a reminder for caregivers that self-care is one of the most important things you can do. And taking that 1 hour for yourself to join like-minded people is probably one of the best things. It's evidence-based. It can alleviate the stress. It can create a community of friendship. It's an answer to social isolation because a lot of us haven't gone much further than the grocery store in the last year. So we wanted to create this community that you can be a part of and join us. And we've also partnered with AARP. They pop in once a month. We have pop-up presenters. I keep it as informal as I can. And they share their knowledge, their program information, and answer questions to the participants. So our Pinkies Up Caregiver Mingle every Tuesday at 2 for tea. And then, of course, we are always looking for volunteers. We do require fingerprint clearance. We do require state security clearances. We do all the paperwork for you. And many of the programs that are offered through our agency rely on committed volunteers to assist us. We're 7 people in 4 counties, and we are looking for help. And what better way to get involved? It can be via Zoom, but all of us will be older at some point, hopefully. And our goal is to be a part of that solution. We want to help people in the same age group as us, in the same needs situation as us. And so, yes, if you have time, if you are able, we require long-term care ombudsman volunteers. We have Medicare volunteers. The family caregiver program, I use volunteers to make reassurance calls. We call our clients and we check on them. We provide them with updates on information. Through the True Alta program, I'm able to send our most current events. We have a local resource page that offers information on our website and our Facebook page. I know that Facebook has some negative connotations, but a lot of organizations use Facebook to communicate, and it's one of the best social platforms out there to get information. Our SEGO Area Agency on Aging utilizes its Facebook page for our webinars. We record those. We do Facebook Live presentations. We just returned from Graham and Greenlee counties where we were in Clifton and Safford. And it was the first in-person hybrid Facebook Live presentation that we have done in a year. So we were super excited about it. We've done that. So our Facebook page is an exceptional source for any of our current events or any pertinent information that applies to seniors. So yes, if you'd like to make a difference, if you have time to volunteer in your communities, I know most of you are probably heavily involved in your faith-based community, but the AAA also relies heavily on that assistance. Let's see what else. Cindy's program is health and nutrition. And with that, we do what is called matter of balance training. It's the first step in training for that, in order to keep the healthy movements and body that's required to prevent those falls. If you do fall, you are able to, it teaches you how to lift yourself up, how to gain the strength in your legs. It is designed for seniors, and it is designed to keep you active and mobile and work on those balance issues, because falls are the most common reason why seniors are admitted to hospitals, long-term care facilities, and unable to stay in their homes safely. So we have the Matter of Balance program that we offer. It was on hold during COVID, but we're about to start rolling it out again. They did not have a video adaptation for it to keep it evidence-based. It's best if it's done in person. So we offer that. And then we also offer online virtual Tai Chi classes, which would be the next step after a senior has accomplished the Matter of Balance classes. Then they would go to the Tai Chi, which is a little bit more physical. I've tried it once. It's a little bit of a workout. You do wind up, it's very smooth. It's like a moving meditation, and it's exceptional for seniors. So we have those two programs. And then Cindy is also responsible for our congregate sites. We have congregate sites throughout our 4 regions that provide meals for seniors. Again, during COVID, they quickly pivoted all of their services, and they started creating the meals and freezing them so that they could still be delivered safely to our seniors. We also have Mom's Meals, which was what we used to call the Meals on Wheels program back in the day. And Mom's Meals is who we contract with, and they actually ship fully prepared meals, microwave safe containers for our seniors who are unable to actually, create that. So that food insecurity has been addressed and taken care of. And it's probably one of our greatest accomplishments. In Cochise County alone, I have some data that we pulled for 2020. We served, we actually touched the life of more than 80,656 people in Cochise County alone. That's huge.
That is
9 97,568 meals, including home delivered and congregate meals, were served. 6,227 hours of case management were offered. 27,414 hours of home and community-based services. Over 74,000 transportation trips, and that's just one way. And then 14 actual complaints were handled by the Ombudsman program. So you see, we do have a presence, we do have a need, and we are here to fulfill all of those. There's a couple of programs that are offered through our partners. The Arizona Caregiver Coalition is online. They offer a home improvement reimbursement program for caregivers. The program offers up to $1,000 in refunds for a caregiver, and this is for home improvement and adaptations if you needed to widen doorways or put in a low threshold shower. It also includes adaptive aids such as hearing aids, or I think they even had dentures on the list, and I haven't seen that offered very often. So there is an 800 number that you can get by either Googling Arizona Caregiver Coalition, Family Caregiver Reimbursement Program, or you can call the AAA at 432-2528. Any one of us can get you that information. Basically, they run their own grant. I help to promote it. So if you call that 800 number and you have questions, they will walk you through the reimbursement process. The only barrier to this that I can see is it has to be paid for in advance. And then they will reimburse you with the receipts. But I would definitely call them if you have any questions, and they can provide that information. So our only requirements for the AAA is that we're serving older adults, 60 and older, people with disabilities and long-term care needs, family caregivers. Our Medicare beneficiaries are served through our SMP and our SHIP program. And then the residents of nursing home and assisted living facilities are through our Ombudsman program. So I've covered a lot of information. I think I've covered just about every cheat sheet I have in front of me. We are a key resource. We have the information. We can provide assistance. We are limited by duplication of effort. So if someone is already receiving services from Arizona Long-Term Care or from VA, then we are unable to stack those benefits. We do have to follow those guidelines by the state. But my program, the Family Caregiver Support, is open to all caregivers. A caregiver is a caregiver. So if they're in need of training or support, they're always welcome. I believe that covers just about every portion of our services. Do you have any specific questions?
I do.
Okay, Dorothy.
You mentioned transportation. What kind of transportation is that, for doctor's appointments and so forth?
Actually, we work with VICAP in Cochise County.
Okay.
Yeah, and we can help assist with getting those arrangements. We've had a couple of instances where someone was out in, say, Portal or out in Double Adobe, where, those more rural areas. And we assisted with that process in getting them to the correct resource and helping them. We work with Easter Seals Blakely Foundation. We work with VICAP. There's a couple of organizations that work on their own that we can assist you with accessing the service. We have a lot of partners. Right now, I've started partnering with the libraries. I've already formed a partnership with Clifton and Safford. I'll be working on Cochise County, Sierra Vista, Huachuca City, Benson, some of the bigger towns, and have their libraries on staff, because nobody is more helpful than a librarian. And they have free Wi-Fi, they have devices. So the barrier of computer literacy or computer devices is removed by having them serve as senior hubs for us. I've trained the 2 libraries so far on the Trualta app so that they can offer the caregiver training right there at the libraries. And they also are going to promote the Pinkies Up Caregiver Mingle. So we'll have our support group, we'll have our Trualta, we'll have our Matter of Balance, hopefully, our Tai Chi, just about any one of our programs, our SHIP and Medicare, our long-term thoughtful conversations, information, all of that will be accessible through the libraries if they don't have a computer at home. And now we're looking at ways to supplement all of that through the American Rescue Plan. They've realized how important our senior demographic is. And because it was so hard hit during COVID, and because there were so many barriers that we identified that we knew about, social isolation in elderly is huge, but 10 times more during COVID. So a lot of the plans that we have and a lot of the information we have going forward will continue to focus on that computer literacy, computer access, at-home services that we can offer, and just access to the information. My boss would be probably very upset if I didn't mention our new Get Set Up program. This one is a computer-based learning system that we are offering through SEGO. We're paying the cost of it. There is a coupon on our Facebook page, and we promote their weekly classes that covers everything online as far as how to Zoom, how to access various programs. They talk about finances, they talk about retirement, and all of these classes, they're scheduled. You have to attend when they're held, but they're all given by people like us that are 50 plus, and they're offered for senior learning. And there's such a wide variety of topics. I've actually taken a couple myself because, trust me, my computer skills prior to COVID were not as great as they are now. It's been a very big learning curve. We've all had to, strap on our gear, and we had to become resilient, and we continue to provide services throughout that entire pandemic and going forward. I don't think Zoom is going away. I think it's going to be a normal part of our life. I know I always wanted it. When I was a child, I watched the Jetsons, and I couldn't wait for the TVs that you could see, the telephone where you could see the person you were talking to. And now we have it, and we're very fortunate. If you consider how many people would be without this connection and how many people are isolated, to me, this is the perfect way to reach out and to be. I'm in Sierra Vista, but I'm sitting in my home in Bisbee. You know what I mean? It's just the best way to connect. And we all know connections are the most important thing that we have. And so we support that. We want our seniors strong. We want them healthy. We want them in their communities and in their homes. And we are one very passionate team of 7 women, let me tell you. So I hope that answered your question. I told you I tend to talk quite a bit. Yes, Reverend Cornell.
So what is the most requested service, I guess, or support from your agency?
I would say over the last year, it was the food insecurity, the home delivered meals. We've started transitions from hospital to home to assist the clients with those transitions. There isn't enough data yet that has been gathered regarding COVID, but addressing social isolation, making sure that our seniors have what they need when they need it. I would say food insecurity, if I had to guess, was probably the most significant ask during that time because, as you know, we were out of toilet paper. The shelves in the stores were getting empty. A lot of our businesses had to pivot and completely change their delivery systems. So ours happened almost overnight. I'm still always amazed at how quickly we were able to take everything that we did and continue to offer it. Our case managers are also, usually they go to the home and they sit with their clients. Well, we're doing a lot of that over the phone and via Zoom. I do all of my True Alta onboarding when I offer the caregiver training. It's via Zoom. We offer the training and yeah, I think.
Did you see a spike in people becoming caregivers that didn't expect to and not knowing how to deal with that?
Yes, ma'am.
I-
Absolutely. A lot of families brought their loved ones home with them because the facilities were so having such a difficult time. A lot of people are working from home to where they typically weren't before. So we have those people that are not only working, they have school-age children, and then they have also the senior in their home. A lot of families came together to support their own family during this time. And so, yes, I did see quite an uptick. One of the challenges of the family caregiver program, and probably the hardest part of my job, is many people do not self-identify as a caregiver. They do it because it's needed. They do it because it was their vows. They do it because somebody has to do it, but they don't really realize that they are a caregiver and that they need that support. And so getting the word out that we're here and we have ways to assist them and we have ways to develop a community of caregivers that, you know, like-minded situations that can assist them is huge. So yes, ma'am, caregivers did increase. I'm looking for them. Do we have any other questions? We are all available at any time to come to your church and speak with your members. We do set up during open enrollment, we set up Medicare health assistance, and we have open enrollment situations. If you're interested in one of our health and nutrition classes, we can do that. If you know of anybody who needs assistance with a family member in a long-term care facility, we are your people. So if we don't know the answer, we'll find it for you.
All right, Karen, thank you so much for taking this time today and speaking to us about all the different things that you can either point us towards or provide for us. And I know you said you've got some flyers you're going to drop off tomorrow.
Yes, ma'am.
Happy to make sure that those get made available for our people. Kind of a light showing today, but we did record this so that they can see this after the fact. And they know that they can get in touch with your agency. The best way to get in touch with you is through an email or through a phone call.
Either one. My email is Enriquez, ENRIQUEZ @seco.org.
And SECO stands for what?
Southeastern Arizona Governments Organization.
And you pronounce it SEGO.
SEGO, SEAGO, and then we always call it the AAA, but it's the Area Agency on Aging, part of SEGO. And my phone number is 520-432-2528, extension 221.
And that's a work number, probably good Monday through Friday?
Absolutely, 8 to 5. And I typically work around the clock, so I'm always checking for messages and emails. So anytime is fine. If you have a question at 10 o'clock at night, send me that email. I might be awake looking at it. So definitely here to serve, and we appreciate our seniors. We are here for you. And if there's anything that we can assist with, we sure like to do that.
Again, Karen, thank you so much. We appreciate you being here this morning, and we'll make sure this gets out, and I will try and get this out of the cloud and email it to you. If the file is too large, I could put it on a thumb drive and you can pick it up when you drop off flyers.
Absolutely. Reverend Cornell, if you could also maybe do a sign-in sheet for me so that I have that information. We do, everything that we do goes to the state, of course. So if I could get your names and your email addresses, I can also send some individual information to you as our events come up. I do a reassurance email, direct mail, or telephone call at least once a month to all of our clients, so I can include you on that mailing distribution.
All right, Sherry put hers in the chat.
Thank you very much.
Rebecca, I don't know you, so I can't really get your information, but if you wanted to do a private chat to Karen, you could send her your email. Same with whoever is behind Galaxy S9. I'm not sure who that is either, but if you wanted to send your contact info to Karen in the chat before you log off, that would, and you can do that in a private chat, not to everybody. That would work.
Absolutely. Okay, I'm sorry that Cindy must have had technical difficulties, or she would have been here also. But if you have any questions about the exercise classes or any information that you need otherwise, please let us know, okay?
All right.
Very nice. Thank you so much for having me, and I really appreciate all of you listening to me talk for a half hour nonstop. Thank you.
Thank you, Karen.
Thank you, Karen.
Bye.
Thank you very much.
Bye-bye.